from top to bottom. My checkoff time does not start until I specifically start assessing my patient. So I'm gonna knock on the door, wash my hands, introduce myself. Hello, I'm Jennifer Anderson. Sorry, my hands are cold. And I'm a nursing student here at the College of Nursing, and I'm gonna do a respiratory assessment on you if that's okay.
Okay.
All right, so the very first thing I'm gonna do is I'm gonna talk to you about some normals. So the first thing is that the normal respiratory rate should be between either 10 to 20 breaths per minute or 12 to 20 breaths per minute. And then I would normally assess to see if your rate is regular or irregular, or if you're using any accessory muscles to breathe. And then I would also check the depth of respiration. So there are three. There is shallow, moderate, or deep. Shallow means that I wouldn't see a lot of rise and fall in your chest. Moderate would be considered normal. And deep would be that I see a lot of movement in your chest. Now, the first thing I'm going to do is look at your transverse to A&P diameter. So this is transverse to A&P, and you are 2 to 1, which tells me that there is no barrel chest. So now I'm going to assess your anterior and posterior thorax. Obviously, I normally have the shirt off. So I do not see any scars, any lesions. Your hair pattern, being female, is more than likely fine villus. I would look at your skin color on your thorax and compare it to that of your hands, your ankles, your face, and it should be consistent with that of the rest of your thorax with the rest of your body. All right, so now I'm going to look at your lips and your mucous membranes. So your lips, they are pink and moist. I do not see any cyanosis. Would you open your mouth for me real quick? All right, so your buccal mucosa is also pink and moist with no cyanosis. So if I could see just one of your fingers. All right, so your fingers, they are slightly convex. The nail beds are pink. There's no cyanosis. I am going to push down on your nail bed. Your capillary refill time is less than 3 seconds. And so now what I need you to do is put your fingers together like that. So I am looking to see if I see a diamond, which I do, which tells me that the angle of your nail bed is less than 160 degrees. So there is no clubbing. And so now I'm going to palpate your chest. So I'm going to palpate both anteriorly and posteriorly. Okay. All right, so I did not feel any crepitation. So the next thing I'm going to do is check you for what we call chest expansion. So I'm going to place my hands on your chest. Okay, will you take a deep breath in and out for me? Okay, and would you turn around for me? Okay, so another deep breath in and out. Wonderful. So you had equal and symmetrical chest expansion both anteriorly and posteriorly. So the next thing I'm going to do is I'm going to auscultate your breath sounds. So if you wouldn't mind, breathe through your mouth, take a little bit deeper breath than normal. I'm going to move kind of fast with my stethoscope, so just breathe normally, but just through your mouth and a little deeper. Okay, if you could turn around for me. Okay, so now I'm going to tell you about what I listened to. So the first thing I listened to was your bronchial breath sounds. Those were located over the larynx. They were only heard anteriorly. The sound was, it was high pitched, it was loud in intensity, and inspiration is less than expiration. The next thing I listened to was the bronchial vesicular breath sounds. They are located both anteriorly and posteriorly. They are located over the major bronchi, which is basically the center of your chest. They are moderate pitch, moderate amplitude, and inspiration is equal to expiration. The last thing I listened to was your vesicular breath sounds. They are located over the peripheral lung fields. They are also heard anteriorly and posteriorly. They are soft, low pitch, and inspiration is greater than expiration. While I listened to all your breath sounds in all those areas, what I heard was your breath sounds were clear to auscultation bilaterally. I did not hear any adventitious breath sounds. So some examples of adventitious breath sounds could be crackles, which could indicate pneumonia, or wheezing, which could indicate asthma. And that completes my respiratory assessment. Thank you.